Anatomy of Face, Its Key Points by Dr. Lakshmi Gayathri. Boundaries of the face. Human face is limited above by the hairline of the scalp, below by the chin and the base of the mandible, and on each side by the auricle. The forehead is common to both the face and the scalp. The height of the human being bears the relationship with the head length. The height of an adult man is equal to 7.5 of the head of the individual, while that of an infant is 4 times of the head length. Face is covered from outside to inwards by the skin and superficial fascia. Deep fascia is absent in face. The skin of the face is highly vascular and therefore plastic surgeries gives excellent results when it is done in a face. It is rich in sebaceous and sweat glands. So, acne is more common in adults, which is due to the inflammation of the sebaceous glands. The skin of the face is thick, elastic, and it is lax over greater part. Hence, it easily permits the rapid spread of edema. But in nose and auricle, the skin is tightly adherent to the underlying cartilage. Hence, boils are more common in these areas and are extremely painful. The underlying superficial fascia or the subcutaneous tissue contains the facial muscles, the vessels, and the nerves. Also, with variable amount of fat. The fat is more abundant in cheeks, called as buccal fat, especially in children. However, fat is absent in eyelids. Facial muscles are skeletal muscles. Though they are voluntary in function, yet they are not attached to bones, and they arise from the superficial fascia. So hence morphologically they are remnants of panicles carnosus. Facial muscles are developed from the second branchial arch, hence it is supplied by the 7th nerve or the facial nerve. They are distributed around the orifices of mouth, eye, nose and ear, and they act as sphincters and dilators of them. The contraction of them also produces or expresses the emotional behavior. Muscles of the eye. There are 4 circumorbital muscles, namely orbicularis oculi, corrugator supercilii, occipital frontalis, and levator palpebrae superioris. Among these 4, the levator palpebrae superioris doesn't belong to panicles carnosus type. A few upper orbital fibers of the orbicularis oculi muscle are called as depressor supercilii. The contraction of the entire orbicularis oculi muscle produces crow's feet appearance in some old people in the lateral angle of the eye. Paralysis of the orbicularis oculi results in ectropion or drooping of lower eyelid, resulting in spilling of tears called epiphora. Corrugator supercilii muscles contraction produces vertical wrinkles expressing annoyance, while occipital frontalis produces transverse wrinkles on the forehead which expresses surprise, horror and fright. The muscles of the nose are 3. They are procerus, nasalis and depressor septi. Procerus also produces transverse wrinkles. The antagonists of occipital frontalis are 2. They are corrugator supercilii and the procerus muscle. Nasalis muscle of the nose has 2 parts, compressor naris and dilator naris. The contraction of dilator naris produces expression of sign of anger. Muscles around the oral fissure. The sphincteric component of the mouth is contributed by the orbicularis oris muscle, while other muscles, which are around 9, forms the dilator component. Among the 9 muscles, 3 muscles are attached to the upper lip. They are levator labii superioris alacovi nasi, levator labii superioris and zygomaticus minor. 1 is attached to the lower lip, which is the depressor labii inferioris. 5 muscles are attached to the angle of the mouth. They are levator anguli oris, zygomaticus major, depressor anguli oris, buccinator and rhizorius. All these 5 muscles convert to form a node-like structure called modiolus. This modiolus is situated just lateral to the angle of the mouth, opposite to the upper second premolar tooth. We have seen the muscles distributed around the eye, mouth and the nose. Now we'll see the expression of each of these muscles. Frowning is produced by corrugator supercilii and procerus by producing vertical wrinkles. The frontalis produces transverse wrinkles and expresses surprise, horror and fright. Dilator nares and depressor septi shows anger. Four muscles are responsible for sadness. They are levator anguli oris, levator labii superioris, zygomaticus minor and depressor anguli oris. They cause the downward movement of the nasolabial furrow and expresses the sadness. The laughing muscle is called zygomaticus major, which draws the mouth upward and laterally. Depressor labii inferioris expresses irony. The muscle for grin is risorus and that for disdain is mentalis. Mentalis also puckers the chin and protrudes the lower lip. The muscle buccinator is covered by an areolar membrane called as buccopharyngeal fascia, which separates it from the ramus of the mandible and the masseter. The structures piercing the buccinator is very important. They are parotid duct, buccal branch of the mandibular nerve, 4 or 5 molar mucus glands lying on the buccopharyngeal fascia around the parotid duct. The origin and insertion of buccinator and the muscles of the orbicularis oris are complicated and I have explained it in a separate video. Nerve supply of face. Each half of the face is supplied by 13 nerves. Among the 13 nerves, one nerve is motor nerve. The rest 12 nerves are sensory in function. Among the 12 sensory nerves, 11 are derived from the branches of the trigeminal nerve, while one is derived from the cervical plexus, that is the greater auricular nerve. Among the 11 cutaneous branches of the trigeminal nerve, 5 are derived from the ophthalmic division, 3 from the maxillary division and 3 from the mandibular division. The 5 branches of the ophthalmic division of the trigeminal nerve are lacrimal nerve, supraorbital nerve, supratrochlear nerve, infratrochlear nerve and the external nasal nerve. While the 3 from the maxillary division are infraorbital, zygomaticofacial and zygomaticotemporal nerve. The other 3 from the mandibular division are mental nerve, buccal nerve and the auriculotemporal nerve. The 12th cutaneous nerve derived directly from the cervical plexus is a greater auricular nerve, supplies the angle of the mandible. The only one motor nerve of the face is the facial nerve, whose 5 terminal branches supplies all the facial muscles except the masseter, which is a point to be noted. The 5 terminal branches are temporal branch, zygomatic branch, buccal branch, marginal mandibular branch and the cervical branch. The temporal branch supplies the auricularis anterior and superioris muscle, upper part of the orbicularis oculi, frontalis and corrugator supercilii. The zygomatic branch supplies the lower part of the orbicularis oculi. The buccal branch supplies rest of the facial muscles except risorus, depressor anguli oris, depressor labii inferioris and mentalis, which is supplied by the marginal mandibular branch. Lastly, the cervical branch of the facial nerve supplies the platysma. Arterial supply of face. The arteries supplying the face are facial artery and the transverse facial artery. Facial artery is also called as external maxillary artery, which is a branch of the external carotid artery that arises above the tip of the greater cornu of the hyoid bone. It runs tortuously upwards, crossing the angle of the mouth about 1.25 cm lateral to it, and then ascends and ends by anastomosing with the dorsal nasal branch of the ophthalmic artery near the medial angle of the eye. In face, it gives inferior labial branch, superior labial branch and the lateral nasal branch. The other artery, which is the transverse facial artery, is a branch of the superficial temporal artery, passes forwards between the zygomatic arch and the parotid duct and supplies the face. Venous drainage of the face takes place through the facial vein and the retromandibular vein. Facial vein lies behind the facial artery. It starts as the angular vein near the medial angle of the eye, continues as a facial vein, and after crossing the lower border of mandible, it joins with the anterior division of the retromandibular vein to become the common facial vein. Finally, it drains into the internal jugular vein. The most important thing is, it communicates with the cavernous sinus by two important routes, through the angular vein and superior ophthalmic vein, and through the deep facial vein and pterygoid venous plexus. The facial vein being valveless, any infection from the dangerous area of the face can be easily spread in a retrograde manner into the cavernous sinus through this route and causes cavernous sinus infection. Lymphatic drainage of face occurs in three zones. The upper area or the upper zone drains into the preauricular or parotid nodes, intermediate zone to the submandibular nodes, and the lower zone to the submental nodes. Thank you.